The knee is particularly susceptible to traumatic injury due to its vulnerable location between the hip and the ankle, where it is exposed to forces from both. For this reason, it is especially important to thoroughly test all structures of the knee. The medial collateral ligament is the most frequently injured ligament of the knee. Injury to the MCL is frequently common with a direct blow to the lateral side of the knee or due to external rotation of the tibia during high-impact activity. Some research has shown the most common location of injury is the femoral insertion of the MCL. The MCL covers a large portion of the medial compartment, so it makes sense that different fibers are stressed in different ranges of flexion and extension. The more flexion the knee is in, the less the anterior, central, and posterior portions seem to be stressed. When the knee is in full extension, the most stress is placed upon the posterior fibers of the MCL. Valgus stress testing is the primary method of diagnosing MCL injury, but few studies have investigated its accuracy or inter-rater reliability. Sensitivity for the test has been reported between 86 and 96%, while specificity has not been reported. In one study, inter-examiner reliability was 68% in full extension and 56% in 30 degrees of flexion. When providing a valgus stress to the knee, a positive test in full extension is indicative of tears of both the MCL and the PCL, whereas a positive test in 30 degrees of flexion and a negative test at 0 degrees indicates only a tear of the MCL. Lateral instability of the knee is much less common than medial instability, but according to some research can be more disabling. This can be explained by what happens to the knee during weight bearing in full extension. The medial compartment is compressed with its ligaments taut but not stressed. On the other hand, the LCL is under extreme tension. During gait, there is considerable distraction of the lateral compartment when the knee reaches full extension, hence the reason for more instability with LCL versus MCL injury. As LCL injuries are much less common than those of the PCL, there are even fewer studies to validate the commonly used Varus stress test. Sensitivity for the test has only been reported at 25% with no mention of specificity. A positive Varus test in extension indicates injury to not only the LCL, but the popliteus and cruciate ligaments as well, whereas a positive test in flexion means that the tear is limited to the LCL. When testing the knee, you want to make sure that you test both the medial and lateral compartments of the knee. The medial compartment of the knee, which houses the MCL, is typically tested by valgus, the valgus stress test. So you want to place the knee in a position where you're going to apply stress on that ligament and sustain that stress. You want to test it not only in 0 degrees of extension of the knee, but also in 30 degrees of flexion so that you stress various fibers of the MCL, specifically the anterior, central, and posterior compartments. When you want to test the LCL, the lateral compartment, you will place the knee in a Varus position of stress. So the Varus stress test is going to pull on that compartment. And again, you also want to test the knee at 0 degrees of extension and 30 degrees of flexion, thereby placing stress upon that ligament and different portions of each part of the test. Okay, Leanna, so I'm going to test the stability in your knee, and I'm going to test it in both the outside and the inside. So to do that, I'm just going to take you through a couple of different tests. One is going to put pressure on the outside of your knee, pushing inside. And if you feel any pain, let me know. It should be a nice kind of firm feeling, not too much give. And then I'm just going to bend your knee a little bit and do the same thing. Any pain with that? No. Great. And then just to test the other side of your knee, the outside, I'm going to come on the inside of you. And the same thing here. I'm going to straighten out that knee. And by putting this pressure, I'm just kind of gapping this outside of your knee. There's a ligament that sits there. And I'm just trying to make sure that structure is stable. And then same thing, I'm going to bend that knee about 30 degrees, which doesn't matter to you, just for my purposes. Any pain with that? All right, very good.